Hi, my name is Kenneth Young, Radiologic Technology student at LaGuardia Community College. And today I will be discussing radiographic findings of a patient with hereditary multiple osteochondromas. This patient is a young adult male who is nonverbal and required the assistance of an aide. The script order from the physician was for bilateral knees and bilateral tib fib. At this site, the protocols for bilateral knees are AP weight bearing, lateral weight bearing, and tangential sunrise of the patella Setagas method. Due to the nature of the patient, there was challenging positioning. Patient care included not overwhelming the patient with trying to assist with too many technologists, approaching him in a confident but not overbearing manner, and talking to him normally and calmly. We were able to perform the bilateral AP projection, but when positioning for the lateral, the patient became uncooperative and the examination ended. This radiograph is from the patient who came in for a routine checkup with radiographic findings of hereditary multiple osteochondromas, which were previously known as hereditary multiple exostosis. This change in terminology from exostosis to osteochondromas specifies that these lesions are cartilaginous processes that ossify and are not simply outgrowths of bone. This is a rare genetic disorder characterized by multiple benign, non-cancerous bone tumors covered by cartilage. Often outward from the metaphysis, which is the widest part of long bone between the epiphysis and diaphysis that contains the growth plate, usually continues to grow until shortly after puberty, in which skeletal maturity is reached and the osteochondromas no longer develop. Inherited as an autosomal dominant genetic condition, where only a single copy of an abnormal gene, being a mutation of the EXT1 and EXT2 gene from either parent, can cause this particular disorder. The median age of diagnosis is by 3 years of age, with almost all affected individuals diagnosed by 12 years of age. Offspring of affected individuals are at a 50% risk of inheriting the disease-causing mutation. Males tend to be more affected than females, and there is a higher prevalency rate in some isolated populations, such as Guam, where 1 in 100 are affected. Other prevalency rates are 1 in 50,000 in Washington state and 1 in 100,000 in Europe. Signs and symptoms associated with this condition are bony deformity, restricted joint motion, compression of nerves from extended pedicle outgrowths from the medullary cortex into soft tissue, and shortened stature. Treatments include surgical resection, which is the removal or cutting away of the tumor to avoid recurrence, limb lengthening, or epiphysiodesis, growth plate arrest, which is a surgical procedure where the growth plate is fused temporarily or permanently to delay growth of the normal leg to allow the shoulder to match. Monitoring the size of affected bones by annual scans aid in early identification of malignant degeneration. Radiographs are a suggested way to detect non-palpable osteochondromas. Many cases require no treatment, and most individuals lead active, healthy lives.